Hello, my name's Eloise and I'm one of the doctors. I've been asked if I can do a vaginal examination on you today. Have you had one of these before?
No.
Okay, so what it'll involve is, first of all, I'm just going to have a feel of your tummy. I'm then going to inspect the outside of the vagina and then insert a speculum, which is a thin plastic tube, into the vagina just to examine the neck of the womb. And finally, I need to do an internal examination. So what this involves is just using 2 fingers just inserted into the vagina and pressing down on your tummy and just feeling for anything there. Is that okay? Some people find it a little bit uncomfortable, but it shouldn't be painful. If you want me to stop at any point, that's fine, just let me know. Okay. So what I'm going to do, I'm just going to ask you to undress from the waist down. I'm just going to pop next door and get a chaperone. If I can just ask you to just get onto the examination bed for me and then we'll begin. Okay. Thank you. So as with any examination, you want to start with washing your hands, putting on some gloves, and you then want to start with an initial inspection. So just looking from the end of the bed, you can see if the patient's in any obvious pain or distress, and see if there's any evidence of any recent weight loss, and they also might have some medications around them. You then want to have a closer inspection of the abdomen. So just looking at the abdomen, seeing if there's any obvious masses, any distension, any swellings, or any scars that might indicate previous surgery. Have you got any pain at the moment? Okay, so if the patient does have pain, you'd always start on the side away from the pain. So I'm just going to have a feel of your tummy now. If it's painful, just let me know, okay? So just feeling around the abdomen, just assessing to see if there's any masses that you can feel, and keeping an eye on the patient's face and just always asking about any tenderness. Does that feel okay there? Okay, so no masses that I can feel there. The patient doesn't seem to have any tenderness. Okay, fine. So for the next part of the examination, I'm just going to have a look at the vulva. So I'm just going to ask if you can put your feet together, shuffle them up towards your bottom, and then just flop your knees out to the side, okay? So once the patient's in the right position, you then want to go on to inspect the vulva. So you want to have a look at the outside of the vulva and also parting the labia just to make sure that you're getting a complete look to see if there's any skin changes, such as any erythema, any lesions. Look to see if there's any cysts, such as Bartholian cysts, or any swellings or signs of inflammation. You can see if there's any lesions which might be suspicious of a vulval cancer. And you can also look to see if there's any evidence of bleeding or discharge. At this point, you can also ask the patient to cough. So could you just cough for me, please? If the patient has a prolapse, then that make that visible. Okay. So I'm now going to go on to do the speculum examination. This can be a little bit stretchy, a bit uncomfortable, but if you want me to stop at any point or if it's painful, just let me know, okay? Okay. So for the speculum, you always want to make sure the speculum is well lubricated. So just inserting a good amount of lubricant. To insert the speculum, you want to hold it at 90 degrees, and then as you're inserting, you want to rotate it round. Okay. And then using your other hand, you just want to part the labia. Okay, so I'm just going to insert the speculum now, okay. Inserting at 90 degrees, rotating, and once it's in, you're going to use your other hand just to push this together. That'll open the blades out, and you should be able to visualise the cervix. Okay. Once you can visualise the cervix, just swizzle this back round and that'll hold the speculum in place. Obviously, when you're actually doing the examination, you would always be looking through the speculum to see what you're doing. I've just taken a step back so that you guys can see. So once the speculum's in, you want to have a good look at the cervix. Look to see if there's any masses, any lesions, or any ulcerations. Could be signs of a benign cervical polyp, or there could be something which looks a bit more suspicious of a cervical cancer. You want to look to see if there's any ectropion around the cervical os, or any bleeding or discharge. Okay, so just having a good look, that all looks normal and healthy there. With the speculum in, you can then take your swabs and your smears. So you're first of all just going to take a high vaginal swab, so using the swab, just insert it, try not to make it, well, make sure you don't make contact with the speculum as you're inserting, and then just rub it around the high vaginal wall just once, move the swab, that can then go back in the pot, and that can be sent away. You can also take your smear. So for this, you use a cyto brush, and what you're going to do is insert the cyto brush into the cervical os and rotate it 5 times. I'm just going to take the smear now. This can be a bit uncomfortable, but it'll only last for a few seconds. Insert into the cervical os, and then you want to rotate. Good, and then remove. And then I haven't got the pot with me here, but what you do is you use a persimmon pot, just shake it just to dislodge all those cells, and then that can then be sent away. Okay, so that's the end of the speculum part of the examination now. To remove the speculum, making sure that you're holding the blades open with this hand, unswivel it, close the blades to about 80%, and then you want to rotate the speculum around similarly to how you inserted it. There we go. So for the last part of the examination, I'm going to do an internal examination. So I'm going to insert 2 fingers into the vagina and have a feel, okay? So again, well lubricate the fingers. Just warn the patient. So I'm just going to insert my fingers now, okay? If you want me to stop at any point, just let me know. So I want to part the labia and insert the fingers, just to make it more visible, along the posterior vaginal wall to the posterior fornix. You then want to assess the cervix, so you want to see if it's mobile, if it's firm. And then in the posterior fornix, you can push upwards with the internal fingers, pressing down above the pelvis, and you can assess if the uterus is anteroverted or retroverted. You can also assess for adnexal tenderness or masses, so just feeling on either side. Sorry, I know you can't see very well from this angle, but pressing down there. That might be indicative of an ovarian tumour, an ovarian cyst, or some tenderness in PID. Both sides, okay. Fine, okay, that all feels okay. At this point you can also assess for cervical excitation. This is something which can show a sign of an ectopic or PID. It's not something which is actually done that often in clinical practice because it's very painful for the patient, but it's something that you can do. Okay, so I'm going to remove my fingers now. As you remove your fingers, gently, and you just want to examine the glove just for any signs of blood or discharge, which I can't see there. Okay, so then you want to remove your gloves, wash your hands. Okay, so thank you very much. That's the end of the examination now. I'll just let you go and get dressed and then we'll discuss what we found, okay? So in summary, this was a normal gynecological examination. There were no abnormalities found on abdominal palpation, on inspection of the vulva, on speculum exam, or on bimanual. We've taken some swabs and some smears. To complete the examination, I would like to do some urinalysis, a urinary pregnancy test, and a transvaginal and transabdominal ultrasound scan.